and diverticulitis. So these two things can be confusing. Diverticulosis and diverticulitis. So the first one is diverticulosis, and the second one is diverticulitis. So what happened in diverticulosis and what happened in diverticulitis? So in diverticulosis, we will say that there is what we call the small pouches. Those small pouches is called the diverticula. You can see it there. Those small pouches. These small pouches. It is called the diverticula. Okay. So it form in the wall of the colon. Okay, it is formed in the wall of the colon, and the issue with diverticulosis itself is that it's usually harmless, but it can lead to complications like bleeding and diverticulitis. So diverticulosis itself, it means that the colon has developed some small outpouching, like small pouches in the colon, because the picture or this diagram you are seeing is just the colon. So that means the colon has developed some pouches. But if you don't take care of diverticulosis, the patient may start having complications like bleeding and diverticulitis. So it's basically saying that people that have diverticulosis may end up having diverticulitis or bleeding. So what are the common contributing factor or what can cause this colon to, um, to start developing small outpouching, or these pouches they form when pressure inside the colon pushes against weak points. So there's like a pressure inside the colon and it is pushing against weak spots. So what can cause it? Low fiber diet can cause it. When somebody is not eating food that helps you to go number two, like bowel, when the food, whatever the waste product is building up. So low fiber diet. Another one is chronic constipation. Another one is age. You know, as people age, there's aging of the colon wall, and also lack of physical activity and obesity. But one thing you must pay attention: the major cause is usually constipation. So when people are not going number two very well, okay, so it will start forming that pressure inside the colon. So people that have diverticulosis, the major symptoms that they can experience is like the bloating of the stomach, at the abdomen. It becomes bloated. They may start having mild cramping. They may start having bowel changes in their bowel habits, and sometimes they may start having like small painless bleeding. Okay, so how do we manage this diverticulosis? Just tell them to increase their fiber. They need to eat something that will increase their fiber. Tell them to drink a lot of water. Tell them physical activity, and they also need to avoid constipation because it's very important. So that is what is your diverticulosis. Tell them to exercise. So major thing in diverticulosis, just a simple term, it is caused when there is a buildup of pressure inside the colon. Okay, the colon start forming small pouches. We call it bulging pouches. It develop in the digestive tract, which is the colon. So the condition in which the diverticula are present in the intestine without any sign of inflammation. So what is the treatment? The treatment to avoid this from happening is the person need to eat a lot of fiber. So eat a lot of fiber, drink a lot of water, exercise, avoid constipation. They also need to avoid nuts and seed. Okay, avoidance of nuts and seed is not necessary. I repeat myself, avoidance of nuts and seed is not necessary because we are going to compare it with diverticulitis. So, what is example of that fiber which you may see in the exam is metamucil or methylcellulose or phylum. Just know the name because it always constantly appears in the exam. A high fiber diet is crucial for reducing the risk of both diverticulosis. Fiber helps to soften the stool and promote regular bowel movement, minimizing that pressure on the colon. So that is your diverticulosis. Then, if you don't take care of diverticulosis, it will lead to diverticulitis. It will lead to diverticulitis. So now, in diverticulitis now is an inflammation going on. So one or more diverticula, it became inflamed or it became infected. So, what are the causes? It can be as a result of the blockage of the pouch. It can be bacteria will start overgrowing, okay, growth and inflammation. So, this person will start complaining things like fever, nausea, and vomiting. Just think about symptoms of infection, symptoms of inflammation, okay, and then person may now have a complication that it may be like abscess, perforation, peritonitis, fistula, sepsis. But for the purpose of the exam, what we need to know here so is just two things. Diverticulosis is the pouches are affected. That is diverticulosis. But diverticulitis, it is the pouches and the inflammation. So two things are happening here. One is just the pouches, which is the diverticulosis. Then diverticulitis is the pouches plus inflammation. So what is this telling you? The treatment of diverticulosis is going to be simple. They need to take high fiber diet. They need to drink water. They need to exercise. But now in diverticulitis, there is inflammation and infection. So the treatment now is going to be antibiotics. So that is your diverticulitis. But the major thing for the exam is to know when it is a chronic stage and when it is acute stage. So when it is acute stage, fiber is not recommended because you don't want to give them something that will make them to keep going. No, at that point, you need to rest the abdomen. You need to rest their stomach. So you are going to cause more stress for them when you are giving them. So in that acute phase, in diverticulitis, in that acute phase, you don't want to give them fiber. So what we give them is low fiber or low residue diet in that acute phase. Please take note of that because it's very, very important. In that acute phase, you want to close monitor them, no fiber, and the bowel rest. They shouldn't be, don't give them something that will make them to be going. That is in the acute phase of diverticulitis. But when it comes to the chronic phase now, you can give them fiber, but not in the acute phase. So in the acute phase, what you just want to do, so this is your acute phase, you just want to prevention of fiber, you just want them to rest the bowel, no fiber because it increases. No fiber increase it increases during the acute flare. So we don't want fiber at that time. And another important thing is that in that diverticulitis, that acute phase, just they of course they are admitted in the hospital. They monitor them for 48 to 72 hours and see how they are doing. But in diverticulosis, again, diverticulosis, the pouches are present, but it is not infected. Everything I'm saying is just for emphasis. It is so in diverticulosis, the pouches are present, but it is not infected. So the management is high fiber, and the example of fiber supplement is that phylum or phylum, which is metamocel or methyl cellulose, and tell them to drink a lot of water. But in diverticulitis, what happened in diverticulitis? The pouches are inflamed. There is pouches, and then it is inflamed. So that is your diverticulitis. Then now we are going to look at the medication. It's kind of confusing, but this is the medication antibiotics for diverticulitis, and is always high yield in the exam. So if you look at the antibiotics for diverticulitis, it's either you are doing the first, you can do, like example, you can do flagyl, which is the primary protocol. Flagyl plus levofloxacin, or flagyl plus cipro, or flagyl plus Bactrim. You see that flagyl is the most common thing. They give them two medication. That is the primary protocol. But this alternate treatment, they can do augmentin or they can do moxifloxacin. Moxifloxacin is also respiratory quinolones. So don't forget, levofloxacin is respiratory quinolones, ciprofloxacin is respiratory quinolones, but they are used for with flagyl and flagyl. But moxifloxacin is a respiratory quinolones. So I would say that it is separate, is used separate. You don't combine it with flagyl. So I have this to remember. You don't have to use it. It's my own way to remember. Facebook Florida Football Club. So Facebook, what is that? FB, that is flagyl Bactrim. FB, flagyl Bactrim. Then FL, that is flagyl Levo. Then FC, Foot Club, that is flagyl Cipro. But however you will remember it, I don't want to confuse you. Just remember it in your own way. However you will remember it. But that is the treatment. And like I said, the treatment is usually very high yield in the exam. So know the antibiotics to treat diverticulitis. It is very high yield, the antibiotics, and also remember we give them hydration, we hydrate them, and they also try to avoid anything that will make them to keep going. So that is the treatment. And this is the lab. So this is here. I just expanded it here. Under the lab, we say that the lab for diverticulitis, CBC, leukocytes. Under CBC, they are looking at leukocytes, the neutrophil, and shift to the left. Some of you will see this in the exam, and you're asking yourself, what is the meaning of shift to the left? These are immature white blood cell, immature neutrophil. Then FOBT plus if bleeding, then reticulocytosis if acute bleeding, and low hematocrit. So this is this. Everything there is this. CBC, the CBC will help to evaluate infection and inflammation. So they check for leukocytosis with neutrophil, often with a left shift. So that word is very important. Before you see it in the exam, you're asking yourself what is left. It's immature, which is also indicating acute infection, immature neutrophil. This is very important. You can see something like that. Then the fecal occult blood cells. So they can do that. The reticulocyte count and the hematocrit and hemoglobin. So this is a sample question. This is a sample question and another sample question here. Which of the following is the first line treatment for uncomplicated diverticulitis in outpatient setting? So just put down your answers. Let me see. Put down your answers.